Chinnadeva. Good evening to everyone and welcome to today's session. Vidya, Pradeep, Alek, Krishna, Jitendra and everybody, absolutely. I too miss all of you guys all these days. Yes, we are going to be regular. Though we were slightly had a interruption last week. So microbiology is the today's subject test. I hope a good number of you have reviewed, and one of our student, Dr. Vishnu, he sent a video. After looking at that video, I suddenly felt completely humbled and clean bowled, and I felt that oh my God, though I don't know that we could really help people by these free sessions to inspire them to prepare in a streamline. Really, it has got a good impact and an outcome, which is most important. So definitely some of you are going to give a video testimonial honestly from inside the heart that how these sessions have helped you to accelerate, catalyze, speed up your preparation. So let's make the great beginning. Which food is most commonly associated with listeria? All of you know cheese and listeria is what you need to basically remember. The soft cheese, undercooked meat, vegetables, etc., etc. And the main reason is the listeria grows at 4 degrees Celsius, and that is the main reason. I'll try to run little fast. It is like winning a century, batting a century. 100 questions we are able to finish means it is like batting a century. Sometimes we will go little slow, take the whiteboard. It is like playing singles in the cricket. So overall, we should finish 100 questions and feel that yes, today we made a mark in our preparation, right? But keep punching your answers, doctor. Please keep punching, please competingly punching your answers. The lethal toxin of the Bacillus anthracis, how does it basically function? It stimulates the release of the pro-inflammatory cytokines, which is the mechanism. So you have a lethal factor, protective factor, that is how it is being fragmented. Lethal factor is a zinc metalloprotease, and that cleaves the MAP kinases, and that lead to the release of the pro-inflammatory cytokines is what you need to basically remember. What are the most appropriate for confirming the diagnosis of sinusitis? You have to take a sinus aspirate in order to confirm the diagnosis of sinusitis. Most of the times, the sinus infections all originate in the oropharynx, transmitted to the eustachian tube is what you have to basically remember. What is the volume of the blood that you need to collect in order to get the single blood culture is the examiner's question. 20 ml is the amount of the blood that you need to basically collect every time. Very practical question. While you are collecting the blood culture is what you should remember. Louse-borne, tick-borne, mite-borne. You have to be 100% sure on all these clinical illnesses. Rickettsia. Rickettsia prowazekii is the one which is transmitted by the human body louse is what you need to remember. Chlamydia pneumoniae. Typically, there is only one serotype which has been identified, and there is no recognized animal reservoir for the chlamydia. And Chlamydia trachomatis versus Chlamydia pneumonia. In contrast to trachomatis, the Chlamydia pneumonia does not have a plasmid. And that is the reason it is resistant to sulfonamides is what you need to remember. So what are the antibiotics which are effective against the pneumonia specifically is one of the favorite questions of the examiner. Macrolides, tetracyclines, fluoroquinolones are the classical drugs which are active against the chlamydia pneumonia is what you need to remember. Another important thing about chlamydia is it does not have glycogen. So if you try to do iodine staining, you cannot be able to use it for the rapid identification of the chlamydia is what you have to emphatically remember. Corynebacterium diphtheriae. How does the diphtheritic toxin basically function? It interferes with the protein synthesis, as all of you know very well, that typically the Corynebacterium diphtheriae, it terminates the protein synthesis because it inactivates one of the important component of the protein synthesis called elongation factor 2 is the one which is being inactivated by the diphtheritic toxin is what you need to remember. Gas gangrene. What is that organism which is involved in gas gangrene? Typically, it is the Clostridium, which is the classical organism. Soft tissue infections, fasciitis, cellulitis, myonecrosis, etc., they're all the gas gangrene. Which mycobacteria is photomicrochromogenic is a very important question. Canaceae, Mycobacterium canaceae is considered to be the photochromogenic is what you need to basically remember. Then Mycobacterium tuberculosis typically is non-pigmented and it is called buff colored, and since the organism which has been isolated in the story is chromogenic, it cannot be tuberculosis. Similarly, Mycobacterium avium is non-pigmented, Fortutium is non-pigmented. Hemophilum is not pigmented. And the only one which is pigmented is Canaceae and Merainum are the ones which are basically pigmented. Photochromogenic is what you have to basically remember. Now, doctor, vancomycin susceptible organism, which one out of all this? It is a streptococcus uniformly susceptible to the vancomycin. And the fundamental principle, all gram-negative organisms are resistant to the action of the vancomycin. All the gram-negative organisms. Doctor, if you have done this question wrong, please once more go back to the video library, DNB क्वेश्चन बैंक का वीडियो लाइब्रेरी, माइक्रोबायोलॉजी में अच्छा रिवीजन करो. माइक्रोबायोलॉजी ऐसा सब्जेक्ट है, there are about 900 MCQs in DNB, AIMS, PGI, All India. अगर आप रिवीजन करके एक 200 लिस्ट ऑफ थिंग्स पट्टी मार के एक 1000 single liners, if you happen to get the grasp, you can score 20 out of 20 in microbiology. I can guarantee you, you have all that video library which is available in the UMedico app and anatomy2medicine.com. So all gram-negative bacteria are resistant to vancomycin. What is the association which is true? If you look at the Bacteroides, typically it is a strict anaerobic gram-negative rod, is the perfect description of the Bacteroides species is what you need to remember. So of all the organisms mentioned here, only Bacteroides, Peptostreptococcus, Clostridium, these are the strict anaerobics. जरा इतना ऑक्सीजन आके टच हुए तो भी वो मर जाएगा, इतना ऑक्सीजन आके टच हुए तो भी वो मर जाएगा. Strict, obligate anaerobes is what you need to remember. Then Bacteroides is a gram-negative rod, whereas Peptostreptococcus in this is a gram-positive coccus, and Clostridium is a spore-forming gram-positive rod is what you have to fundamentally remember. Shigella sonii, how does it escape the phagocytic mechanism is a very, very important question. So fundamentally, the phagosome, lysis of the phagosome and the replication in cytoplasm, our body has their own defensive mechanisms to contain an organism. If the organism becomes brilliant to overcome the natural defenses which are available in our body, it is very difficult to kill them. So that's how Shigella functions, is what you need to remember. Now, what is that antibiotic active against a cell wall deficient Mycoplasma pneumoniae is the favorite question of the examiner. So my request to all of you, doctor, every Saturday 4 p.m. to 6 p.m. you have a PowerPoint slideshow which is running. Please take every opportunity to solve the questions. Then this session looks very interesting. Second, if you are already subscribed students, you get all these test explanations, everything available like a PowerPoint slideshow in the UMedico app. But otherwise, you can call our home helpline number 900-868-356. You can call this number, WhatsApp this number, request our helpline to send the PDF of the question paper and the explanatory booklet. They will send you that. So you keep that question paper and try to solve while attending this PPT, and then The discussion, all these explanatory answers are available in the PPT. I mean, in the what you call the PDF. You can always do the revision. But what I want you to do is MCQs are available everywhere. Every damn book they are available. You should solve it. You should do wrongs. You should get stimulated. You should then go and correct yourself in those topics where you are falling short. That is the whole idea of every Saturday's subject test. Be very sure. Similarly, is the case with the Sunday grand test also. 9 to 12, take an opportunity to sit and solve the questions. You have a PowerPoint slideshow running on the YouTube. 12 to 2 or sometimes I will be late. By 1 to 3, we will have a discussion. Once more get inspired. So this Saturday, Sunday should keep on going. Already a schedule has been given to all of you. Okay, doc? Now, which antibiotic against mycoplasma? It is the azithromycin. Favorite question of the examiner. Sudha Shukla, Pradeep Reddy, absolutely right. Azithromycin is the drug of choice which you have to invariably answer. Now, doctor, एक पेन और व्हाइट बोर्ड पेन पेपर पकड़ने का समय आ गया. How are the various drugs working? Is the favorite question of the examiner. So fundamentally, doctor, you have a mRNA. इसके ऊपर संस्कृत लिपि में लिखे हुए हैं आपका नसीब. mRNA is all that story that need to be interpreted for the protein synthesis. Then typically you are having a ribosomal RNA, and there is a 50S portion and there is a 30S portion. That is how a ribosome is being created. Then you are having a growing peptide. Then the tRNA is the one which is bringing one after the other the various amino acids is what you have to fundamentally remember. Now, the various antibiotics function at various levels which you have to be very sure. Now, the first thing, chloramphenicol. How does it function, doctor? Chloramphenicol comes and inhibits the 50S portion of the ribosome, and that typically inhibits the formation of the peptide. Formation of peptide is what you have to fundamentally remember. Okay, dokie. Now, you have erythromycin. How does it function? Erythromycin, like macrolides, they bind to the 50S tRNA and they prevent the movement along this mRNA. So that is the function of erythromycin. How does tetracycline fundamentally function? So fundamentally, tetracycline functions, always there is a codon which is there on the mRNA, anticodon. Anticodon reads the codon, and that will then decide the correct amino acid to come and become part of the growing peptide. So tetracycline interferes with the anticodon of the tRNA from reading the mRNA's codon. That is the function. Anticodon ka reading is inhibited by the tetracycline. So it leads to misreading is what you need to remember. Then how does streptomycin function? Streptomycin, it changes the 30th part of the ribosomal RNA, 30th portion of the ribosomal RNA, and that also will lead to misreading of the anticodon and codon. कोडॉन को पढ़ने से मना करता है क्योंकि 30S is being damaged by blocked by the streptomycin. Even tetracycline also, codon and anticodon, ये दोनों के बीच में it will bring a dissociation. That's how tetracycline functions. But streptomycin does the same thing by basically destroying the 30S. So 30S streptomycin, 50S chloramphenicol, erythromycin also 50S is the one, and tRNA के बीच में the relationship is being disrupted by the erythromycin. Examiner's favorite question always is which is 50S acting, which is 30S acting, which lead to misreading of the codon, anticodon. This is the favorite area. Little more extensively, we have discussed all these areas in the UMedico video library. So please do review that. So mycoplasma is resistant to all those antibiotics that interfere with the synthesis of the cell wall. You take penicillin, ampicillin, sulbactam, etc., cephalosporins, carbapenems, vancomycin, ये सब इसके हवा कहाँ है? They go and inhibit the cell wall synthesis. But mycoplasma does not have a cell wall. So any cell wall synthesis inhibitor cannot be able to act on the mycoplasma is what you have to emphatically remember. Now there are a lot of vaccines that have been developed against Neisseria. Which serogroup polysaccharide is a weak immunogen and it cannot elicit antibodies? It is a serogroup B is what you have to basically remember. The exotoxin, which is being produced by the botulinum, how does it basically act? The botulinum toxin blocks the release of acetylcholine is what you need to remember. Harshit Gupta, Sudha Shukla, please keep punching your answers. I'll be very happy. Yes? Now, a group of MBBS students in final year and some of the house surgeons, they requested that sir आप ये जो बेसिक साइंसेस पहला पढ़ा रहे वो जरा पीछे करके स्केड्यूल में फर्स्ट फिनिश 1.5 month मेडिसिन, 1 month सर्जरी, 1 month gynops and 15 days pediatrics, 15 days orthopedics. Totally 5 months में मेडिसिन, सर्जरी, gynops, ortho, pediatrics जरा खत्म करो sir. We will all come and sit in the physical class also. So from Monday onwards we will start general medicine. So there are 123 topics in general medicine. हम बहुत MCQs पढ़ाई दिया, but we will try to review 20 points, 10 points, 15 points on each topic so that it is both good for the review of the final years and also for the interns. So that is going to be from the Monday evening onwards. So you can even tell your juniors who are in final MBBS also, they can attend. So we will have 1.5 months, 6 weeks medicine, 4 weeks surgery, 4 weeks gynops, 2 weeks pediatrics and 2 weeks orthopedics, and then once more we come back to the basic sciences. So that is the plan, क्योंकि ये major subjects एक बार खत्म हो गया तो mind के ऊपर tension निकल जाएगा. I have to sign? Yeah. 1 minute, doctor. Yes, I will give you the new schedule where from Monday onwards we will have the medicine starting up, and also you can all send a request to our helpline. Uh, they will send you the PDF of the notes of the quick synopsis of points on every topic that we are going to finish the revision from Monday onwards, right? So for the notes, please WhatsApp, and always my request is, though we are not for money, we teach for our satisfaction, for our happiness. To spend time with you guys, it's a privilege, the God-given privilege. But still, we need to run an organization. I will be grateful to you guys, those who have not paid the fee, to pay the fee, subscription, even if it is a small amount, so that you get many advantages of the mock tests, the discussions, the notes, the past video library, everything, both web and app access to all the contents. So your paying subscription fee will help us to pay salaries to the group of the people. So take an opportunity to enjoy the free session, no doubt. At the same time, take a chance to buy the subscription is my request to all of you. Now, doc, Clostridium botulinum, it blocks the release of the acetylcholine is what you have to fundamentally remember. Now, if you look at the normal neurotransmitter release, the acetylcholine become released and there is a snare protein which is involved in the vesicle, synaptobrevin, and that whenever a nerve stimulus is there, the acetylcholine is released, the postsynaptic receptor gets stimulated, then the muscle contraction occur. It is a nicotinic receptor which you typically have. Now, the botulinum neurotoxin, what does it basically do? The botulinum neurotoxin, it cleaves this snare protein. A snare protein को break करेगा. And because of that, this acetylcholine release does not occur when it has to occur. If it does not occur, the postsynaptic receptor is not stimulated. If the postsynaptic receptor is not stimulated, muscle contraction doesn't occur. And that's how you get the paralysis, is what you have to fundamentally remember. Now, doctor, which enteric pathogenic hemolytic uremic syndrome? Easy question. Shigella dysentery. Diagnostic test most commonly used in leptospirosis. Which one? It is a serological detection of the specific leptospira antibodies is the fastest way to detect. Live attenuated vaccine to prevent infection. Obviously, BCG is a live attenuated vaccine. Which organism can contaminate the foods which are being refrigerated? Yersinia enterocolitica can grow at refrigeration temperature, is what you have to fundamentally remember. Now, doctor, Listeria monocytogenes, how can it escape the phagocytic mechanism of the body? It is the lysis of the phagosome and replication in the cytoplasm. Our body has a defensive mechanism using the phagolysosomal fusion with which it can be able to kill and eat the organism. That's being prevented by the Listeria, and it escapes the defense mechanism, is what you have to fundamentally remember. To identify Enterococcus members, what is the test which is being used? It's called PYR test, pyrrolidinyl aryl imidase test, is what you have to fundamentally remember. So, enterococci are the part of many urinary tract infections, etc., etc. How can you rapidly detect it? It is the PYR test, which is for the rapid detection of the Enterococci is what you have to basically remember. I am very happy to see 45 online students. Now, what is the test for the recognition of the Streptococcus pneumoniae, doctor? Bile solubility test. Then, to recognize Staphylococcus aureus, what is the test? Coagulase test. Candida albicans, it is the germ tube formation. To identify Streptococcus pyogenes, it is the bacitracin susceptibility is the one which is used for the Streptococcus pyogenes. ये सब चीजें इतना खास चीज होता है माइक्रोबायोलॉजी में. Whole microbiology is about gram positive, gram negative organisms. Streptococci, Staphylococci, Enterococci, E. coli, gram negative organisms. इसके बिना अगर क्वेश्चन पेपर है तो पूछो मुझसे. So that is very, very important, doctor. Now, 1 week old infant को meningitis हो गया. So which organism is commonly associated? Streptococcus agalactiaceae group B is the one which is most commonly affected, most commonly the one which is associated with the meningitis in this age group. Both Streptococcus agalactiaceae group B streptococci and the E. coli. H. influenza between 3 months to 5 years. Neisseria and pneumonia are common in older children and adults is what you have to basically remember. Similarly, now, Haemophilus fails to agglutinate with the typing sera, unlike Streptococcus pneumoniae. So, what is the most likely reason for this is my question to all of you. The organism does not have a capsule, which is the underlying cause. So, the most common H. influenzae strains in nasopharynx, they're all not capsulated, non-typable strains is what you need to remember. Now, bacteria becomes resistant to chloramphenicol. How does it happen? It happens because the bacteria learn how to bribe the antibiotic. It leads to acetylation of the antibiotic and make it ineffective to do its job. That's how the chloramphenicol resistance happen is what you need to remember. So chloramphenicol 50S ribosome, chloramphenicol 50S ribosome, tetracycline 30S ribosome. That's what you have to fundamentally remember. Now, Guillain-Barré syndrome, it is a Campylobacter jejuni which is being implicated. Bacillus cereus, how do you get it? You get it through the eating of the rice which is contaminated. And vancomycin resistance mainly, how does it happen? Vancomycin is acting on the cell wall. So, modification of the pentapeptide side chain in the cell wall peptidoglycan is the mechanism by which vancomycin resistance typically develops is what you need to basically remember. Now, doctor, resistance to vancomycin has been reported against which species of Enterococcus? Enterococcus avium is notoriously, Enterococcus avium is the one which did not develop. All other species have developed vancomycin resistance is what you need to remember. Levofloxacin, the fluoroquinolones, how are they bactericidal? They inhibit the DNA topoisomerase is what you need to remember. A 2-year-old awakened from the sleep, acute pain in the left ear membrane is being swollen. What is the main source? Always remember, doctor, a sinusitis, ear infections, इन सब का source होता है हमारा mouth, oropharynx. सुबह और शाम दांत क्लीन करना before you go to sleep. You brush the teeth nicely, go to sleep. You will never get सुबह सुबह sore throat आ जाता, वो सब चीजें होता ना. You will not get affected at all. The whole problem is night time if you don't wash the mouth after the food before going to sleep. If you don't wash the mouth, while you are sleeping, it perpetuates the growth of the organisms, and slight amount of aspiration normally occur into our sinuses, into our respiratory tract. By the time you wake up in the morning, you will be surprised with a sinusitis, with a sore throat, etc. etc. इसलिए 2 बार दांत क्लीन करो, आपके पेशेंट्स को भी बताओ, they will be far away from the possibility of the sinus infections, etc. etc. Simplest things that our grandma has taught us. Now, doctor, which enteric pathogen invade and replicate in the M cells in the Peyer's patches? Salmonella enteritidis. Enterococcus faecium virulence is associated with what? Typically, antibiotic resistance. It can grow very fast. That makes it the most virulent organism, leading to a high case fatality, is what you need to remember. Now, what are the 2 major toxins which are responsible for the pertussis? Dysregulation of the adenylate cyclase in the host cells. Typically, the pertussis toxin activates the guanosine diphosphate binding proteins, and that promote the action. Normally, they promote the action of the adenylate cyclase, and this lead to the interference of chemotaxis, phagocytosis, and many other cellular functions, is what you have to basically remember. Surely, Aparna says, sir, mid-year exams के लिए कुछ करेंगे? Definitely, mid-year exam means you mean AIMS and DNB, right? Yeah, definitely. We will try to at least take one of the days in the week to revise the DNB and AIMS most recent question papers. But already the previous question bank is already well discussed and available, doctor, in the video library. You can always revise that question bank, the DNB and the AIMS. But what is important, ultimately what you are going to win is the long-term goal. December, by about October, you should finish all subjects, high-yield topics revision करना. October, November, December में जितना mock test हो सके उतना mock test attend करना, scoring करना, and January में you have to hit the jackpot. So that is the whole idea and the plan. Now, doc, clindamycin is bacteriostatic. What is the mechanism? Clindamycin blocks the peptide elongation by inhibiting the peptidyl transferase, is what you have to basically remember. So you should know what are the macrolides, how do they function. Clindamycin, it blocks the peptide elongation because it binds to the 50S ribosome, and it inhibits the peptidyl transferase, interfering with the binding of the amino acyl tRNA complex. That is the mechanism, is what you should basically remember. A toxoid vaccine, where do you use? Corynebacterium diphtheriae, fundamentally vaccine is a toxoid. The bacterium becomes resistant to oxacillin. How does it happen? It is a protein binding, penicillin binding proteins. The modification of that will lead to the penicillin resistance, oxacillin resistance, is what you have to fundamentally understand. Now, doc, Vibrio cholera, the exotoxin, what is the mechanism? It stimulates the adenylate cyclase activity and makes a lot of secretory diarrhea to happen. That's how it functions. Which is a mite transmitted disease, doctor, out of all this? It is the rickettsial pox, which is the mite transmitted disease, is what you have to fundamentally remember. So, yes. Now, which organism is a common cause of sinusitis? It is the Moraxella catarrhalis, which is the common underlying cause for the sinusitis. Metronidazole, which organism is susceptible out of all this? Bacteroides fragilis, typically surgical infections. To prevent it, metronidazole, the anaerobic antibiotic, should always be available to attack them. Stomach of the humans, which organism basically colonizes? Lactobacillus is the part of our stomach as a colonizer. Now, Campylobacter jejuni commonly is chicken के अंदर क्या है? Campylobacter jejuni है. So more than half of the Campylobacter jejuni infections are because of the consumption of the improperly cooked chicken, is what you need to remember. 50S ribosome inhibitor, obviously macrolides like erythromycin are the 50S ribosomal inhibitors, is what you need to remember. Tetracycline, 30S ribosomal subunit. Now, a 30-year-old woman who has HIV infection, which viral protein is important for causing the replication, which is not essential for replication? NEF is not required. GAG is required. GP120, integrase, they are all required for the replication of the HIV, is what you need to remember. Now, we need to be little careful in this question because this is one of the favorite questions of the examiner. If you have done this question wrong, you have to go back and today only revise HIV. HIV के बिना एम्स नहीं होगा, DNB नहीं होगा, no NEETPG होगा. So that much important is the HIV. You have to be very sure. So GAG, GP120, integrase, protease. These are the ones which are important for the viral replication, is what you need to remember. Now, the GAG, what is GAG? Group specific antigen. It is the one which has got a capsid protein which is required for the virions, virion structure. Similarly, the GP120 is required for initiation of infection. Initiation of infection. And the integrase is required to insert the viral DNA that enables the viral replication, is what you need to remember. Similarly, protease is required for the maturation of the virion. Maturation of the virion. So, doctor, GAG, GP120, integrase, protease, all these important viral proteins you have to be very sure about. 57-year-old with leukemia, T cells from the patient indicates a retroviral DNA. What is most consistent with it? Retroviral DNA can be because of an endogenous virus, is what you have to remember. So, HTLV1, it does not express an oncogene. HIV and HTLV1 can infect the same cell type, but HIV kills the CD4 T cell. HTLV stimulates the multiplication of the CD4 T cell, and HTLV1 has a lag period of up to almost 30 years before it leads to the development of the human T cell leukemia, is what you have to fundamentally remember. A new drug has been used, and if you happen to give it in the first hour, third hour or fifth hour after the exposure, 100% inhibition of the viral replication is happening. But if the drug is given 8 hours after the exposure, only 20% inhibition is happening. Now the examiner's favorite MCQ is, which part of the life cycle of the viral replication is this antiviral drug is basically inhibiting is the favorite question of the examiner. So fundamentally, you should know what are the steps in the viral replication. First, binding to the host cell, penetrating into host cell, uncoating of the protein and DNA synthesis, assembly of the new virions, and escape from the host cell. So these are the various steps in the viral replication. इन चीजों में typically the new drug, when it is added as late as 5 hours after the exposure, it is still able to inhibit the viral replication, means it is not affecting all those steps which are preceding the assembly. So assembly के पहले जो है ना, binding to host cell, penetration of host cell, uncoating protein and DNA synthesis, all these things it is not affecting. It is only affecting the assembly of the virions. That is the reason if it is being given typically after 8 hours, it is only 20% effective is what you need to remember. A wrestler is having vesicular lesions along the vermilion border of his lips. What is it? What is that producing? So you should think of herpes. So typically the herpes, it is the thymidine kinase enzyme which is being produced, is a scavenging enzyme which is encoded by the herpes simplex virus is what you have to basically remember. A pap smear typically showing coilocytosis. It is the classical feature of the human papilloma, and in situ hybridization analysis of the cells from the cervical smear is considered to be the mechanism or the diagnostic test of choice is what you have to fundamentally remember. So this is how the HPV-16 positive squamous cell carcinomas typically are staged. 34-year-old, fever, headache, seizures, speech and behavioral problems. So what kind of brain tissue would confirm that HSV was the causative agent? So it is the Cowdrey type A inclusion bodies which you typically see in case of herpes simplex virus meningitis. It is the Cowdrey type A inclusions. So Cowdrey type A, also called type 1 inclusions, are the features of human herpes virus 1 and HSV1, where typically you see them, and also in CMV infection also you find Cowdrey type A. Cowdrey type B जो होता है, इसमें दो तरीके होते, एक बेसोफिलिक वाले और दूसरा एसिडोफिलिक वाले. So Cowdrey type B basophilic is adenovirus. Cowdrey type B acidophilic is poliomyelitis virus. Typically lead to the inclusions in the Androhon cells which are of Cowdrey type B. Acidophilic is what you have to ultimately remember for the tomorrow's exam. After exam is over, let us forget all these things. But until exam, Cowdrey type A क्या होता, type B क्या होता, उसमें एसिडोफिलिक क्या होता, बेसोफिलिक क्या होता, पूरा tip of your nose में बैठ जाना. So 20 out of 20 you can win in microbiology. It is such a predictable subject, right? 47-year-old Japanese, CD4 T cells that carry HTLV1. So what is characteristic of this condition? Typically, it is sexually transmitted. It leads to adult T cell leukemia or lymphoma, and tropical spastic paraparesis is also caused by the HTLV1 is what you have to basically remember. So it is like an IPL match. We finished 50 questions. We have 48 online students. I am very, very happy. Just let us give 2 minutes voice break and restart. Ultimately, we have to make a century and go to the home. So that is the whole idea. So please stay online. 2 minutes, we will reorganize. So welcome back to this Chai Pe Charcha with Dr. Murali Bharadwaz. It's like a IPL evening that we recharge ourselves at least with 100 reviews and then choose 5, 6 topics, get inspired to once more go back to the video library and do the revision. HSV infection is reported as a cause of neonates' death. How can you recognize it? Restriction, fragment length polymorphism. RFLP is the technique to discover, diagnose the DNA sequence, which is different from one strain of HSV to that of the other strain. To recognize that RFLP is a wonderful technique and trick is what you have to basically remember. Vaccinia virus. It is used as a vector in many cases. How does it basically work? Fundamentally, the viral genome has many non-essential genes, and the vaccinia vector contains and cause the expression of these inserted genes which replace the non-essential genes, and that enables the vaccinia virus to become a vector to carry the genes is what you have to fundamentally remember. Leukemia hai, immunocompromised child is there. Which vaccine can still be given safely? Never give live attenuated vaccines in those people who are having immunocompromised state. So that is the reason you can give safely a inactivated vaccine. Out of all the 4 given to you, it is the influenza which is the inactivated vaccine. A gynecologist discovers vesicular lesions on the thumb, and the smear of the cells can be stained with hematoxylin. Then what is it most likely to be? Typically, once more, it is the HSV. Cowdrey type A inclusion bodies, herpetic whitlow is the one which you have to fundamentally remember. These are called the Downey cells, which are the abnormal lymphocytes which are typically seen in EBV infections. आने वाला एम्स और DNB exam में image based questions में you are going to get Downey cells. Then you will remember Dr. Murali Bharadwaz, right? You will remember these lymphocytes, right? Now, these are the coilocytic cells, which are typically seen in the case of the human papilloma virus infection is what you have to remember. These are called the owl's eye inclusion bodies, which are typically seen in case of the cytomegalovirus infected cells is what you have to fundamentally remember. We use the immunoglobulin against the varicella zoster virus. So what is the main difference between varicella zoster virus and herpes simplex virus? Between chickenpox and herpes, what is the main difference? The varicella zoster virus, that is the chickenpox, can establish a viremia, but herpes simplex virus, it cannot lead to the development of the viremia, which is the fundamental difference is what you need to remember. But otherwise, unlike HSV, VZV is transmitted by the respiratory route is what you have to fundamentally remember. And both HSV and chickenpox, varicella zoster, they both produce syncytia, they encode thymidine kinase, they are neurotropic. इसलिए acyclovir is used both in the case of the HSV and also the VZV is what you have to remember. So now, doctor, 11-year-old, there is a hyperplasia of the prickle cells and coilocytosis. So how does this replicate? Fundamentally, this is caused by that kind of a virus whose replication is dependent upon the epithelial cell differentiation stage is what you need to remember. So typically what this growth is called is a common wart, and it is caused by the HPV transmitted by contact and respiration. The replication of this virus is controlled by the maturity of that underlying cell is what you have to remember. Which is the organism that can colonize the skin, doctor? Melasthesia furfur is the one. Tinea versicolor, it can colonize. It is a lipophilic fungus. In those areas which are rich in sebaceous glands is the place where melasthesia basically perpetuates, is what you need to remember. How do you treat melasthesia, doctor? Selenium sulfide shampoo is the one which you will be using. So how will you recognize melasthesia? This kind of whitish areas. If you patient will be worried, am I having vitiligo? I still remember one of the medical student is asking, sir, is this a case of albino? Showing me the melasthesia furfur infection. So doctor, always it is enthusiasm. As an undergraduate, as a house surgeon, जो भी किताब में हम पढ़ते हैं उसका डायग्नोसिस करने के लिए कोशिश करना है. Can be wrong, right, doesn't matter. But committing the diagnosis, you should start practicing it right from your second year MBBS when you go to the clinicals. Now, the fungi which are staining with calcofluor, white stain, how does it happen? They all have chitin, which is responsible. Tick-transmitted diseases, babesiosis, Chlamydia trachomatis के लिए you use the DNA probe in order to make the diagnosis. Haemophilus ducreyi. What is the treatment of choice? You should remember, doctor, that we use the rifampicin in case of Haemophilus influenzae for the prophylaxis, and Haemophilus ducreyi causes chancroid, and azithromycin is the drug of choice to treat the Haemophilus ducreyi, which lead to the development of the chancroid. Is a favorite question of the examiner. Clostridium difficile का gold standard test क्या होता है? Always the tissue detection of the cytotoxin assay is considered to be the best way to make the diagnosis. Gram-negative enteric bacteria, enteric rod is which one? This is very important question, doctor. Klebsiella. Now, I am going to make you the champions. Many times this topic हमने white paper pen लेके बहुत बार discuss किए. Gram-negative, gram-positive rods, bacilli, cocci. एक क्लासिफिकेशन जो होता है ना डॉक्टर, जितना भी as many times as you can revise with your classmates with a pen and paper in the hand, it is one. Because one question is going to come on this classification. If you look at the gram positive, you have cocci and you have rods. फटाफट बोलो बेटे, gram positive cocci आपको क्या मालूम? What are the things that you know? Enterococci, streptococci, staphylococci, streptococcus, right? Streptococcus. These are all called gram positive cocci, is what you have to remember. If you go to the reading room, you will find the classmates who say that streptococci वो gram positive है या gram negative है भी नहीं मालूम होने वाले NEETPG aspirants हजारों रहते हैं. टेंशन कुछ भी नहीं है. एक बार समझ में आ गए तो forever you know that it is gram positive. We may miss it in MBBS, still we will pass microbiology. But let me tell you, doctor, these basics we should not miss. We should be strong. Entrance preparation, cracking NEETPG is a very easy private affair. It is a very private affair. Shanti के साथ आराम से you can become NEETPG toppers provided you have a focus. what to read, what to buttify, what to logically understand, what to revise, और दोस्तों के साथ क्या पढ़ना है, अपने आप क्या swallow करना है. That you should know. If you know that, no running here and there. वो coaching classes, ये coaching classes, ये Saturday, Sunday, day longer classes, इधर उधर अगर भागना शुरू करे तो you are wasting your time. You should not waste the time. Now let us talk about the rods. Gram positive rods. फटाफट बोलो बेटे. Bacillus, Bacillus cereus, everything is gram positive rod. Clostridium, Corynebacterium, then Erysipelotrix, Lactobacillus, Listeria, Propionobacterium. They are all the rods which are gram positive, is what you have to fundamentally remember. So you are not going to forget this, and it is one of the favorite questions of the examiner. Now comes the gram negative. Don't worry, I am rubbing the board, and we have discussed this, doctor. This is all there in the video library. Medico and anatomy to medicine.com में once more और एक मर्तबे मैं आपको याद दिला रहा हूं. ग्राम नेगेटिव क्या होता है? Once more, cocci, then non-enteric rods and enteric rods. Enteric rods. That's how you can broadly divide gram negative organisms. और एक बार बोलो, cocci, gram negative cocci, gram negative non-enteric rods, gram negative enteric rods. This is the most important classification which you need to remember. अच्छा, gram negative cocci, फटाफट बोलो बेटा. 3 चीजें होते हैं. Acinetobacter is gram negative cocci. Moraxella is gram negative cocci. Then Neisseria is a gram negative cocci, is what you have to remember. Then what are the non-enteric rods which are gram negative? B से 3 चीजें होता. Bartonella, then Bordetella, pertussis है ना? Bordetella, Bartonella, Brucella, ये चीजें gram negative non-enteric rods. Then Francisella, Legionella, Pastorella, and Pseudomonas, Bartonella, Bordetella, Brucella, Francisella, Legionella, Pastorella, Pseudomonas. It is just like you have Kavita, Sunita, Anita, Pranita, all your list of classmates, right? So similarly, Bartonella, Bordetella, Brucella, Francisella, Legionella, Pastorella, they are all non-enteric rods, even Pseudomonas. Then everything else is enteric rods. That is Bacteroides, Campylobacter, Enterobacter, E. coli, Helicobacter, Klebsiella, Proteus, Salmonella, Serratia, Shigella, Vibrio, Yersinia, ये सब चीजें gram negative enteric rods. You know how to revise these things? You are a very hard-working, serious student for NEETPG. Your roommate is a lazy bugger. He is not waking up at all. मॉर्निंग जब आप रीडिंग रूम को निकलना है शुरू करो ग्राम नेगेटिव नॉन एंटेरिक रॉट्स बोल के उनके ईयर में शुरू करो बार्टनेला बार्डेटेला ब्रूसेला फ्रांसिसेला लेजिनेला पास्चरेला सुडोमोनास he will wake up and then rush to the washroom and then join you to the reading room. So this is how you should wake up by doing a loud revision of microbiology, and that makes all your classmates to get up and start running to the washroom in the morning. So Dr. Corynebacterium, typically how does it act? It inhibits the protein synthesis by inhibiting the elongation factor 2 is what you need to remember. Then enterococcal UTI, the most serious condition that can lead to the complications, or it can lead to subacute endocarditis because of this wound infections and enterococcal UTI is what you have to fundamentally remember. Now, Bordetella, typically pertussis toxin causes lymphocytosis, not lymphopenia. Examiner is very sure what he is asking. If you are also very sure what he wanted, then that moment where there is no albuminocytologic dissociation between NEETPG aspirant and the examiner NEETPG aspirant dissociation nahi hona. You should be ready. Acha, ye puch rahe na? Even while having a look at that question on the monitor in the exam hall, you should be ready, anticipating and attack it. Oh, aggression rehna, right? A gram stain of the voided urine in a patient with UTI, pink rods. They are able to reduce nitrates. They are able to ferment glucose. Arey baap. Itna clues dene ke baad, if you can't recognize E. coli, only God can help. E. coli, gram negative rod, hence it is pink, fermenting glucose, converting nitrate to nitrate, and it is oxidase negative is what you have to ultimately remember. Now, skin colonizers, Staphylococcus epidermidis, 58-year-old gram-negative organism, urease producing, obviously Helicobacter pylori. So you give a triple therapy, antibiotic, bismuth and proton pump inhibitor. 2-year-old, the spinal fluid, pleomorphic coccobacillary organisms which are gram-negative. So what is the thing that you want to do? You want to grow it in the chocolate blood agar and identify the organism by the growth factors, because it is Haemophilus influenza that we are talking about, which is pleomorphic coccobacillary gram-negative organisms found in the spinal fluid. So it requires factor X and factor V is what you have to remember. Whooping cough with regard to the pathogenesis. So typically there is accumulation of a large amount of intracellular cyclic AMP, and it produces a dermonecrotic toxin. It leads to the ischemic necrosis, and there are agglutinogens which help the bacteria to attach to the host cells. They are all the true things with regard to the pertussis is what you need to remember. Now, Klebsiella. So what is that mechanism where directly the plasmid direct transfer is responsible for the replication? Kumar Tirunagiri is asking, sir, is it not Neisseria? इसके पहले ये क्वेश्चन में why not it is Neisseria? The point is there is meningitis, 2-year-old, right? And all this description of the organism fits more into it being H. influenzae is what you have to remember. Good doubt. Now, how do you detect bacteria? The various tests. Streptococcus pyogenes. We use the PYR test in order to identify it is what you need to remember. Catalase, oxidase. What is the importance of this test? Catalase test is the most important test to differentiate within the gram-positive organisms. Staphylococci are catalase positive, streptococci and enterococci are catalase negative. Even a UKG, LKG child also, MBBS first year के आने के पहले भी 12th class only, all these things nowadays are adding into the NCERT books slowly. So you should be very sure ऐसे चीजों में wrong नहीं करना, नक्को करना. If you do wrong on these issues, examiner, competition will throw you out 10,000 miles away. So staphylococci catalase positive, streptococci and enterococci are catalase negative. Then what is the importance of oxidase test? Oxidase test is mainly to differentiate the groups of gram-negative organisms. Then PYR test, it can identify the Streptococcus pyogenes and the species of enterococci which are typically positive for this test is what you need to remember. 22-year-old student is having diarrhea. Raw cheese he was eating. Cheese means listeria. Then which is that organism that colonized the plastic catheters? Epidermidis. A emaciated patient in Chenchalguda prison has a sputum streaked with blood, acid-fast bacilli. Classically, Mycobacterium TB. Rough, non-pigmented colonies is what you need to remember. So typically on the Levenstein-Jensen medium, buff-colored colonies of Mycobacterium which are heaped up is the classical appearance. Once more, a NEETPG AIMS exam, they are going to not leave you. They are not going to leave you if you are not sure to interpret the image-based questions. Bordetella pertussis. How do you want to give chemoprophylaxis to the household contacts? Remember, erythromycin is the drug of choice to treat acute pertussis, and it is also the chemotherapy, chemoprophylaxis drug of choice also is erythromycin. Only if erythromycin treatment failures are there, trimethoprim sulfamethoxazole is an alternative choice is what you need to remember. 33-year-old mycoplasma. Typically, how do you describe mycoplasma? Absence of the cell wall is the characteristic feature. Coming to the normal flora in the body, what is the most common cause of the community acquired pneumonia, doctor? It is the Streptococcus pneumoniae. Community acquired pneumonia is caused by Streptococcus pneumoniae, H. influenza, Klebsiella. 3 organisms you should remember: Haemophilus, Streptococcus pneumonia and Klebsiella. Primary atypical pneumonia, Mycoplasma and Chlamydia. Nosocomial pneumonia, you should underlying causes gram-negative aerobic bacilli, Staph aureus, anaerobic bacteria. Then hematogenous pneumonia is because of Staphylococcus and Streptococcus. So all these funda you have to be very sure, doctor. So the ability of an organism to colonize the respiratory mucosa, it is dependent on which important bacterial structure. Pili. Pili enable you to colonize. Legionnaires' disease. What is the main reason for Legionella pneumophila infection? It is typically atypical acute lobar pneumonia. It will have multi-symptoms, multiple systemic symptoms will be there. Watery diarrhea will be there, and it is a cause of the community acquired pneumonia in the adults is what you have to basically remember. So it is the failure of the phagolysosomal mechanism that enable this organism to evade the host defense mechanism is what you need to remember. Can you off that? Yes. So now, doctor, 78-year-old, acute urinary tract infection. The bacteria is growing over the entire blood agar. यूरियस टेस्ट वाज पॉजिटिव। इतना बोलने के बाद भी अगर प्रोटियस मिराबिलिस आपके दिमाग में नहीं आए तो you are missing the game, is what you have to be very sure. Now, doc, so this is how a swarming type of a growth, where it is growing across the entire agar plate, is what you have to remember with regard to protease. Urease test, you off the main switch. Yes. Urease test typically help to identify which organism. Enterobacter, Corynebacterium, Helicobacter, for all of them, not chlamydia. That is what you should remember. Green pus is being formed. Then obviously you will be thinking of Pseudomonas. So Pseudomonas are the most antibiotic resistant organisms of all the bacteria, is what you have to basically remember. They are the oxidase positive gram negative rods classically. Now this is the pyocyanin, which is a water soluble green pigment which is being formed by the Pseudomonas, is what you should remember. And Pseudomonas can only grow on the surface because they need oxygen to survive, is what you should remember. Pontiac fever, it leads to atypical acute, typically Pontiac is influenza like illness, and recovery is usually complete within 1 week, and it infects otherwise the healthy individuals, is what you have to remember. Now, doc, Salmonella typhi, carrier state, where do you find, which organ carries it? Easy question. Typhoid Mary, it is the gallbladder which is the common carrier of the typhoid, is what you need to remember. The low pH of the adult vagina, how is it basically maintained? It is a lactobacillus which is responsible. A newborn has 39.4 degrees Fahrenheit, gram positive cocci which are present in chains. What is the organism you are thinking of? It is the group B streptococci. So always it is a part of the flora of the maternal vagina, and when a newborn is being born, there is a chance of him getting infected, is what you should remember. Now, these are typically beta hemolytic, hydrolyze the hippurate, and they will be camp test positive. So that is the classical description of the group B streptococci, which are called Streptococcus agalactici, is what you need to remember. तो इसलिए आप वो DNB क्वेश्चन बैंक रहता है डॉक्टर वीडियो लाइब्रेरी in the U Medico. So please try to do the revision. Yeah. Now, yes, Burkholderia mellii. What is a wrong statement about it? It is an immotile organism, Burkholderia. It is the etiological agent of the glanders. Human to human transmission can occur. But the main difference from the Pseudomonas aeruginosa versus the Burkholderia mellii is basically immotile organism, is what you need to basically remember. Now, now a 12-year-old playing the soccer, when she began to limp, osteomyelitis is being found. What is the cause of the acute osteomyelitis? Most commonly, it is Staphylococcus aureus, which is the most common cause. Now, from a carrier, you acquire the infection. So, which is that disease acquired from a carrier? You all know typhoid Mary, etc. They're all the examples of the carriers. 27-year-old is having a rash like this, copper colored skin rash, which is macular rash. Classical of the syphilis is what you need to remember. So it is a treponema pallidum, is what you should remember. Good to see 53 online students. Yes. Now, melioidosis is caused by which organism? Pseudomonas, pseudomallii is the one which is leading to melioidosis. So the melioidosis has different kinds of presentations: acute superititis, pneumonia, bone joint infections, etc., etc. There's a diarrhea after eating a raw shellfish in Cochin. So what is the most possible organism? Vibrio parahemolyticus is the one which you need to think whenever the seafood is the one which is under the question, which is leading to the development of the diarrhea, is what you need to remember. So predominant bacterial species that stays in the human skin is which one? Staphylococcus epidermidis. So Vidya, Madhu is asking, sir, revised timetable fatafat batao. So very simple, doctor. From Monday onwards, let us start general medicine. 134 topics hai. Already they are all discussed and available in the video library. नहीं है बोल के कुछ भी नहीं है. In the UMedico app and anatomy2medicine.com. But the question is, हम सब साथ मिलके पढ़ेंगे, 30 क्वेश्चंस क्विज करेंगे, साथ मिलके पढ़ेंगे, 30 क्वेश्चंस करेंगे, ताकि you have some goal. So you get motivation to go back to the video library, do the revision, take quizzes, solve questions, get ready and get yourself equipped. 6 weeks medicine, 4 weeks surgery, and 4 weeks gynops, 2 weeks pediatrics, 2 weeks orthopedics, 5 महीने गुजर जाएगा. After that, we will once more come back to this basic sciences, and starting from October, November, December only revision करेंगे. रोज एक subject test ले लेंगे, 100 questions. Subject test ले लेंगे, 100 questions खेलेंगे. So October, November, December, all 90 days, we will have 90 into 100, 9,000 questions revision karenge. Chalo, right? So that is a goal. But what I want to tell you is, doctor, any coaching can easily become bleaching. You can lose your time. Unless that coaching inspires you to read, you pick up the topics, you do the revision. That is what I want to tell all of you, right? So Kumar is asking a very good question. Sir, for hip is eroded, salmonella is given in marrow. Arey bhai, marrow ya hero ya kuch bhi ho. Acute osteomyelitis, most common organism. India ho, Andaman ho ya England ho ya Scotland ho. Staphylococcus aureus. अगर आपके दिमाग में कुछ भी नहीं निकल रहे, answer Staphylococcus aureus as the organism in orthopedics. That will be the correct answer. So that is what you should remember. The beauty part of the today's preparation is you have content abundantly available everywhere. Books में है, web में है, इधर है, उधर है. मगर पढ़ना, दिमाग के अंदर घुसाना, टॉपिक्स में जो बट्टी मारना है उसको बट्टी मारना, रिप्रोड्यूस करना, consistently 300-400 hours बैठ के पढ़ना, that is inevitable, even if it is after 100 years also. So my job is how I can bring that compliance in you to stick to a plan and subscribe yourself to become the winners in the forthcoming NEETPG exam. So that is the story, doctor. Now, 18-year-old presents to the physician, and CMV is the causative organism. So typically it will be monospot test, Epstein-Barr virus or cytomegalovirus. They can be responsible for the development of the infectious mononucleosis is what you need to remember. So only EBV can produce the heterophile antibodies That's the reason it will be the one which will be positive for the monospot test is what you have to basically remember. Madhu correctly says Salmonella is only in sickle cell osteomyelitis special organism. Otherwise, Staphylococcus aureus. Now, infectious mononucleosis once more. Typically, a heterophile antibody is the one which agglutinates the sheep or horse. RBCs is what you have to remember. Now, the main difference you should remember, infectious mononucleosis is caused by both CMV and EBV. Magar monospot test heterophile antibody only EBV, not CMV. That is what you have to write it in your diary. Now, doctor, outer polysaccharide capsule that helps to survive the host defense mechanism. It is the Neisseria meningitidis, which is the capsulated organism. So finally, the century 100th question for the today's evening, doctor. Needle stick injury. Patient is using illicit intravenous drugs, thinking of hepatitis B as etiology. What is that become detected first? Obviously, it is the hepatitis B surface antigen positivity is the way by which you will be able to recognize. So, thanks for a wonderful evening by all of you, doctor. फिर मिलेंगे कल सुबह सुबह 9 बजे. Please come. Full scale NEETPG mock test every Sunday. 9 to 12 you have a slideshow. And then if not 12, I'll come by 1 o'clock or 1:30. I'll keep updated. And then we will have a couple of hours. Once more, 100 questions marke gar jayenge. So every day, let's get stronger, stronger and stronger. And inform all your friends. Monday evening say we are starting general medicine. And I want to see at least 200-300 of your classmates coming and joining this free YouTube Chai Pe Charcha sessions with Dr. Murali Bharadwaz. Thanks for a patient listening and enjoy the weekend. Good night.